It was interesting because if we go back a little bit more than a year and a half now, right? It started with some vague symptoms over the course of like 2 or 3 months. My primary care had been monitoring my normal blood work on a quarterly basis anyway. And he said at one point early in 2024 that we might want to monitor this. So he did, had more blood work in June of 24. And that's when he called up right after the blood work came into his office. He called up and basically told me to get down to the emergency room, that I could have something serious. So I did. Long story short, in short order, they did diagnose me with some kind of chronic leukemia, but they didn't know exactly what it was. And that's really been the rub of this whole thing, because it took really over a year for me to find somebody who could really identify exactly what this was. Until that point, it was always, they kind of knew it was this sort of LGL leukemia, but they didn't know exactly what it was, what was causing it, and most importantly, they didn't know how to treat it. So there wasn't one sort of big aha moment where somebody said, you have this, and this is what we're going to do. It was a gradual process where they basically narrowed it down to tell me exactly kind of what the situation was. They really never gave me a treatment that was specifically targeted toward the cancer. They first started out with a Band-Aid infusion. Actually, I guess it was more of an injection with something I think called filgrastim. And that was really just to help my neutrophils. And it certainly helped my neutrophils, but it also flared up my rheumatoid arthritis, which I had never really had an issue with until those infusions. And those injections, I should say, and those injections really turned me into the Tin Man, where I couldn't move my head, couldn't do anything. So that wasn't good. So they stopped giving me those. The next thing that Mayo tried was rituximab, and we did rituximab infusions for maybe 3 months or so. I think they were a monthly thing, if I remember correctly. And it worked, but they really didn't do, I guess they did not work, but they weren't really doing much of anything. So then they switched me over to a weekly methotrexate shot. So I self-administered a methotrexate subcutaneous shot weekly. And gosh, I was on that for like 9 months until we finally got to City of Hope and the trial, and we discontinued that. But even that really didn't do a whole lot. And aside from the rheumatoid arthritis and some random other, symptoms, I mean, thank God none of the meds really, put me through the ringer. But again, none of them really addressed the issue either. So it was a lot of trial and error on the doctor's parts, I guess. So for us, it's been a lot of preventative measures, right? Because the form of leukemia that I have, it reduces your immune system's ability to fight infection. So a lot of it's been adjusting my diet and really going back to COVID protocols when it comes to oral hygiene and hand washing and hand sanitizer and staying away from crowds and whatnot. And for my wife and I, it was really difficult for a long time because we're very social beings, right? We do a lot with people. We're really involved in our church, and having to kind of pull back from all of that and become less involved was really a challenge for a long time. And like I tell everybody, it could have been a lot worse, right? But that really took its toll emotionally over the months that we were dealing with it. But just knowing that this is something now we know it's something that's treatable but not curable. It's sort of wrapping your mind around that and what that really means for the long term. And I'm not sure we're 100% reconciled with it, but I think the conclusion that we've reached is we're not going to stop living our lives. We've only got one life to live. We're not going to stop living our lives. We're going to keep going. We're going to be safe and use wisdom, but we're not going to stop living our lives. So my wife's been my caregiver, and she's been just, I don't have enough adjectives to be able to describe how wonderful she's been. She's absolutely, I mean, she saved me the few times when I had to run to the emergency room. I mean, at midnight, after having an infection or something and waking up in the middle of the night, vomiting and with a fever, and having to get to the emergency room, immediately. I mean, she just jumps up. She forces me to leave, right? Because I'm stubborn and I'm like, I'm going to be fine. Just let me rest. Well, she's, telling me you're not going to be fine. We got to get you to the ER. So she's taken care of me so well. Probably saved my life once or twice, during those sickness bouts. And she's done so much research to help this process. I think a huge part of the journey, the healing journey, has been these alternative treatments that she really found. Every morning I go and do cryotherapy. I do red light therapy. And that was a direct result of her research and finding out that there's evidence that these things would help. And she found a place close by. And, I've been going. And then the gym. I've been going to the gym a lot too, and doing some weightlifting, and again, that was a result of her encouraging me after doing all that research and saying, look, I've seen some folks talking about this working. It's going to help your body, help you build things back up, help you build your immune system back up, and give your body the ability to fight back. So that's been a huge part of my healing regimen too, and yeah, I mean, she's been a lifesaver. Aside from staying positive, putting healthy protocols in your life, just generally, right, to stay emotionally healthy, because it's going to be a journey. There will be challenges. Not every day is going to be your best day. So just be prepared for that emotionally. Make sure that you do have a good caregiver, a good support group around you, because this is not a small thing. This is a big thing. It's going to affect your life. And manage expectations. Right? Depending on your employer, talk with your employer about it. Make sure you manage expectations, because again, I was very blessed to be able to have a situation with my job where I could take that time off to rest and recuperate from side effects and things like that. If you can manage expectations and build an environment around you where you can do the same thing, that's going to help so much.